Welcome, everybody. My name is Tim Dye, and I am one of the multiple PIs of a very interesting project that we're doing with partners in the Dominican Republic on language deprivation in the deaf community there. We have a large group of people and quite a lot to cover, so we're going to be a bit short as we're running through, and we hope that if you have any questions that you'll be able to ask us at this conference or connect with us later. So this is the culmination of about a 20-year collaboration that we've had in the Dominican Republic that started with our ITMI project on informatics training in Costa Rica, which ultimately added the Dominican Republic and has passed through continuous funding from then until now on a number of projects. And we're very fortunate to continue to be collaborating with people who were early participants and trainees of our projects 20 years ago. So that's a really interesting continuous team that we have, and I'm very pleased that we're going to be able to introduce them to you today. The project involves 4 partners, Pucamaima, which is the main university partner in the Dominican Republic, and Sordo, which is the local association for the deaf community in the Dominican Republic, the University of Rochester, and Discovering Deaf Worlds, which is a US-based nonprofit organization that also works in the Dominican Republic. So we will have representatives of each of these groups speaking about what they do with this project. I'd like to introduce the other multiple PI in this project, Dr. Wyatt Hall, who is an assistant professor at the University of Rochester. And Wyatt is going to talk to you a bit about the aims of the project and the science that we're investigating. Wyatt?
Can I go ahead? Okay. Hi, everyone. My name is Dr. Wyatt Hall. And the point of this study in particular is that we have noticed in the last 10 or 20 years in the United States, there's been a discussion within our community about the impact of people's language experiences and how it affects their quality of life, their ability to get work, their mental health concerns, and disparities of a number of kinds that we see in our community. This project explores those same kinds of experiences in the Dominican Republic related to language. Most deaf children are born into hearing families who do not already know sign language. And so the early language experiences that we all need for our brains to develop, for our social skills to develop, and our ability to function in the world don't happen naturally. Now, there are technical interventions like hearing aids and cochlear implants, which are often tried first. But internationally, we see that the experiences that we have in the United States look very similar in other countries around the world where deaf kids are not getting that early language exposure. So we work with the deaf community in the Dominican Republic to see if the experiences that we observe in the United States are the same or different, or we have 3 aims to this project. We want to understand, first of all, the deaf community's experience in the Dominican Republic and what their language experiences are like in their everyday lives. So their lived experience. And what are the community health concerns as well right now? Access to interpreters, doctors, etc. We want to create research capacity within the deaf community in the Dominican Republic so this work can grow from there and we can support the local deaf community as they begin to run their own research and advocate for their own needs. Then we envision this project as a collaborative of 4 organizations, and that this collaboration would continue to grow and build capacity across the span of the project. Next slide.
Okay. Mi nombre es Cristobalina Betemí, soy profesora investigadora de la Pucamaima. La Pontificia Universidad Católica Madre y Maestra es una institución académica con más de 60 años sirviendo y formando profesionales en el país. Hemos estado colaborando con la Universidad de Rochester por más de 10 años y tenemos experiencia trabajando con comunidades rurales y marginales en nuestro país. Como parte de este proyecto, Estamos coordinando las actividades de investigación que se hacen en el país, incluyendo los de las gestiones del Comité de Bioética.
Hey everyone, my name is Pablo Taveras. I'm the president of the National Association for the Deaf in the Dominican Republic, ANSORDO. ANSORDO is responsible for fighting for deaf rights in their everyday lives. We've been partnering with the University of Rochester, Discovering Deaf Worlds, Pucamaima, and it's been a really important project that really could impact the lives of deaf people. So we're doing this research about sign language and language deprivation and deaf experiences here in the Dominican Republic in their lives. So we'd like to improve like how many people in the teens, what's the information that they have in their experiences for the deaf people in the Dominican Republic. So we're going to be looking for deaf participants in the Dominican Republic in the 32 different provinces of the country. And we're going to be interviewing them, and we're going to record those interviews in groups and also in individual interviews. And we'll write down those answers, the information that they give us about their life experiences.
Hi, my name is Sachiko, and I am a co-director of DDW, and we're based in Washington, D.C. in the U.S. I work in various international organizations, and our focus is primarily on developing organizations' capabilities through collaborations with people like Insordo and USAID. And in this project, what we're doing is providing advocacy and training related to data collection and making sure that everything is done as it's required to be through Pucamaima and through Ansordo.
Okay, so University of Rochester, first of all, is an academic partnership here in the US. As Tim had mentioned, we've had funding continually with Pucamaima, and we've also been responsible to work with Ansordo and DDW, and it's a very nice way for these four organizations to work together. For us, we are primarily the partner that takes care of the research training, the IRB, data collection, and coordination across the project with all the partners. In coordinating, we coordinate not only meetings, but also data analysis, and then the framework of the structure of collecting the data from the community. We developed this relationship through some pilot work that started 2 years ago. That was a proof of concept small project where we got just a small group together and worked collecting data. We did interviews one-on-one and in focus groups, and many of the people in the Dominican Republic responded that their exposure or access to language, usable language, didn't start until 6 or 7 when they entered school. It was quite late. We know today that from a neural developmental standpoint, early exposure to language is critical for proper brain development. Delayed exposure to language can have significant impacts across the lifespan. So we are looking forward to growing more data collection across the entire country through the next phase of this project. Next slide, please. This project, we were awarded an NIH grant in R21 for this, and then COVID hit. What we imagined doing is not exactly how things have turned out, because we had to restructure it. We had a plan for training in country, and that has happened over Zoom. We meet weekly with our partners from Ansordo and DDW. We have about 8 participants from the deaf community. We're training them to do the data collection. So whereas normally we would have imagined flying there and doing this kind of training, at this point, we are at an intersection where we work with how we can run the project typically is now that those pieces are done online. So we've experienced some need for persistence, patience, adaptation, and making the best of a real life situation. I'll let Tim take it from here. Tim?
So thank you very much. We hope that you find this project as interesting as we do. This is a absolutely fantastic team to be working with. We've been working together for several years. You can notice that we have several languages going on at the same time. One of our philosophies is that we all use the language that we're most comfortable in. So you see Alyssa doing Dominican Sign Language and Patty and Marlene doing American Sign Language, and our collaborators use whatever language is appropriate for them. And we have Spanish and English all going at the same time. So we've got this down. We have a weekly meeting, and they're wonderful meetings to participate in. We're making really interesting progress, and I just have to say that this is one of the most interesting projects that I've ever had the pleasure of being part of. So we appreciate NIH trusting in our science and in our partnership, and we're very grateful for the partners that we have on the ground and all the effort that everyone's putting into it. All right, so this is our team. This is part of our team, and we're very happy to be able to have shared our project with you today, and we look forward to answering any questions. So long.